If not, I am also recording this and we can definitely make sure to get it to you. Okay, and hearing no complaints, we'll go ahead and get started. Thank you so much for joining us for today's Avail on an update on the DOH's investigation into the complaints about contaminated water from the Navy water system. With us, we have Deputy Director of Environmental Health, Kathy Ho, and I'll turn it over to Kathy at this time.
Hi, everyone. Thank you for joining us. I just wanted to give us a brief, everyone, a brief report on what DOH is doing and what has occurred. So on Sunday evening, DOH was notified by the Navy of complaints of fuel-like odor coming from tap water. DOH and the Navy received complaints through Monday from the users of Joint Base Pearl Harbor-Hickam water system. This includes Aliamano Military Reservation, Red Hill, and Nimitz Elementary School. It also includes the military housing at Aliamano. The DOH has received over 100 complaints. All of these complaints have come from the Navy's water system. The Board of Water Supply users are not affected by the Navy's water system, as they are separate water systems. The Navy and DOH are working together to investigate these complaints. Yesterday, DOH collected samples and will continue to collect samples daily. It also sent the samples to a local lab and a lab in California. We should be receiving the results from the California lab sometime at the end of this week. We have already received the samples, the results from the samples that was taken and sent to our local lab. Those samples were inconclusive. Since these samples were inconclusive, the preliminary results were inconclusive, we've issued a recommendation last night that all users of Joint Base Hickam Pearl Harbor water system should avoid consuming the water. The Navy's water system users who detect an odor from their tap should also avoid using the water for bathing, washing dishes, and laundry. These recommendations will be in place until we receive results from the mainland, and we will adjust accordingly. If we'd like to recommend that if any of the Navy's, anyone affected by this, please contact the Navy and they will be able to assist. Finally, the Department of Health believes that the Navy is responsible for maintaining a safe and reliable source of drinking water for its consumers. We have been in contact with the Department of Education and understand that they are taking appropriate actions to keep their schools open and provide a safe environment and water source for their students. DOH's oversight over the water system, but our directive is to protect human health and the safety of the Hawaii residents. And these recommendations are appropriate steps to take in this situation. We will continue to provide you updates as we are available. The telephone number for the Navy is 808-448-2570. Thank you. I can take questions if anybody has any.
Kathleen, this is Daryl Huff. Can you
Hi.
hear me? Hi.
Yes, Daryl, what's your question?
What does inconclusive mean? I mean, does that mean you found something but you couldn't tell what it was, or does it mean that basically the water was clean for all intents and purposes? Or could you describe a little bit more of what that actually means?
So on island, we have a lab that can only detect to 5 parts per million of contaminants. When I say it's inconclusive, the testing did not show that there were any contaminants to 5 parts per million, but that doesn't mean that there isn't any, because people have been complaining of the odors. So we're finding that in the interest of public safety and to protect human health, we're taking a very conservative approach.
Can you give more information about which areas are affected? I know you mentioned the Eliamanu Military Reservation, Red Hill, those are very general. Is there a more specific location or areas that are affected by this?
Yeah, I know we have had some information about that. What I can do is I could get back to you on perhaps a more discrete area.
Do you know how many customers total are in this area?
So in all, the Navy has reported that the water system services approximately 93,000 people.
Kathleen,
Any
in terms of the sampling process that you went through, so you said you were informed by the Navy Sunday night, but you didn't really get your sampling done till Monday.
Correct.
Did the Navy provide you with samples that were closer to the period of time when people were complaining? That's one
Yes.
question, because it's a volatile chemicals, right? Potentially that would be evaporating out of the water fairly quickly.
Yeah, so we were notified by the Navy Sunday evening, and the Navy provided samples to the Department of Health again Sunday evening. So they were very responsive, and we sent those samples off to the lab. I believe Sunday or Monday.
And has DOH collected its own samples as well?
Yes, DOH collected its own samples yesterday, and we have 2 teams going out today.
How many households?
I can't give you a number on the households. I can tell you that yesterday we did 6 households. I mean, I'm sorry, not 6 households. We did 5 schools and 1 household. Of course, the Navy is also going out and doing its own sampling as well.
Has there been any testing that you're aware of at the Navy's shaft, the Navy's well? Or has it all been down at the consumer level? I mean, have they ruled out any spill that might have been responsible for this at the sources?
We're investigating the source. Both the Navy and the Department of Health is investigating the source.
Can you elaborate on that process? You mentioned the Navy is responsible for maintaining water. What exactly is the procedure they're supposed to follow? And is there some sort of fine or consequence if they're not reacting enough or reacting in a certain amount of time?
So obviously the Department of Health's responsibility is to protect human health and the environment. The Navy, and we regulate the water source by setting forth standards. But the Navy is the purveyor of the water. So the Navy has a permit to issue the water to its customers.
You know, I've heard from neighbors who say they've been getting headaches, stomach issues, and they believe it's associated to the water. Has the Department of Health also gotten those reports?
Yes, we have.
And what are they saying?
Well, right now we're taking down the all complaints, and we are investigating the sources.
Is it possible that the symptoms that they're feeling is connected to the water?
It is possible that the symptoms that they are experiencing can be related to exposure to petroleum.
I don't know if this is more of a question for a medical doctor, unless you're also a medical doctor, but
No.
what kind of symptoms are people reporting that they're feeling, and what kind of logistically symptoms are possible from contaminant water that someone can experience?
Yeah. I think I would defer that to the Navy and to the medical, to our toxicologist. I'm happy to arrange for an interview with our toxicologist.
There's been longstanding concerns about Red Hill contaminating the Navy's drinking water system. And I know that nothing has been, determined as to whether there is actual fuel contamination or what may have caused it. But what is the plan if that does happen? I mean, do you guys have like a written document that lays out contingency measures, how people are supposed to get water, any sort of cleanup, remediation? What does that look like?
Okay, so there are other sources of water on island that we can draw from. And I think that's a really good question that you might be able to pose to the Board of Water Supply.
So I understand.
Kathleen, Kathleen, given what you've heard from all of these complaints, and have your investigators actually smelled something? Do you really think something has happened here? I mean, there are times when social media will get going and it might be, I mean, I hate to suggest this, it might be some hysteria involved. Do you actually think there was something that got in the water in that system that is causing all of these issues?
So I can tell you that our inspector did detect the odor of fuel at Red Hill Elementary and at a Aliamanu Child Center. And in those cases, the Department of Health and the superintendent of DOE has worked together closely. And the Department of Education has provided water sources for its students.
So you do believe that there is some level of contamination or was some level of contamination, even if a test doesn't show it? You had a professional out there using the human capability of smelling it along with everybody else.
Well, yeah, so I can report factually that the one of our DOH inspectors did detect an odor of fuel-like odor in the tap water.
Can you, so it was from the water, just wanted to clarify, it wasn't the air, it was the water.
Yes, from the water.
And also wanted to clarify, so the results from the 5 parts per million test of contaminants was inconclusive. What happens if this really specific test still doesn't detect anything, but obviously we're smelling stuff? What else can we do to figure out where is that smell coming from in the water?
Well, I think in those instances, the Department of Health can continue to investigate the source by looking at lines and other things. So we will continue to investigate if there is complaints of odor, and we can detect odor in the tap water.
So I understand that the Navy pumps water to deliver to its own customers and the Board of Water Supply manages its own pumps, but am I correct in thinking that the military and Board of Water Supply are pumping from the same aquifer, correct?
So ultimately, the source of the water is the aquifer, but there are natural barriers within the aquifer that will separate the two sources. So the Navy source is different from the Board of Water Supply source.
So are the rest of us, the surrounding areas, at risk or not at risk because of that separation?
Well, I mean, I think if it's drawn from the Board of Water Supply source, it's a different source than the Navy source.
Kathleen, the Navy has just issued a press release where they are asking everyone to flush their water system in their homes. Basically, they're saying even though they have not detected any petroleum constituents, that they are urging people to flush out the water systems. What do you think will be the impact of that? Do you think that will solve the problem? I know you don't know exactly what the problem is, but is that a good tactic?
Yeah, I would defer that question to the Navy, but I can say that we will stand by our recommendation until we get further results.
Okay, so even if someone flushes their water for an hour, your recommendation would be to hold off on drinking that until we know what's going on.
I would stand by our recommendations, yes.
Kathleen, is DOH assisting at all in helping residents and schools in that area obtain water? That's a lot of people, a lot of households to be without water for 3, 4, 5 days. Is DOH involved in coordinating that effort at all? I'm hearing a lot of reports of people running out of water. It's getting really expensive for military families.
Right. So we, the Department of Health is not involved in that. We would rely on the water purveyor. In this case, it would be the Navy.
I just had a
question.
I had a follow-up question. I may be repeating myself, but I just want to be certain. So are you saying that the water for everyone not on the Navy system is safe right now?
I believe so. Yes.
Kathleen, when you say that the Navy is responsible for providing a clean and safe drinking water source for its residents, its people on its system, does that mean that when the system is impaired, that they are also responsible for providing fresh, clean water to their constituents? That is, in an emergency, they are the ones who should be providing the water.
That's, I think that's a question that you'll have to ask the Navy. Their obligation is to provide safe, clean water to their customers.
And it's not just military families that are hooked up to this water system. Could you clarify what specific schools use the Navy's water system and any other non-military businesses or institutions?
I cannot give you, I can't give you the exact businesses or schools. I can tell you that we've sent our investigators out to Red Hill, Nimitz, and Aliamanu schools. But you know, what you can do is, if anybody has receives a Board of Water Supply bill, they are not on the Navy system.
So if DOH doesn't have that information, that information, it only is with the Navy itself? I mean, it would seem like we want to know who's on the system, right?
I would say it would be with the Navy and with the Board of Water Supply.
Can you provide an update on the status of the contested case hearing? Where are we at with that?
So the state of Hawaii made a motion to the director to remand the case to take further testimony. I believe that motion, I don't know whether that motion has, what the status of that motion. It's with the hearings officer.
Okay, and will the ultimate decision on the Navy permit be Dr. Char's alone, or is she also receiving consultation from the government?
The statute provides that the Director of Health will make that decision.
Kathleen, there was a lot of confusion yesterday among residents not really knowing what to do, whether the water was safe. There was some criticism that it took a really long time before DOH or the Navy released any sort of definitive, public guidance. Could you talk about why it took so long to issue the advisory, and whether that was something that you feel is ultimately the responsibility of the Navy or DOH to do?
As I stated previously, it is the Navy's responsibility to provide safe water for its customers. And we were investigating, the Department of Health was investigating the complaints, and we did not want to act rashly or harsh, or we wanted to act in a reasonable, rational, conservative way.
Thank you. Any last questions?
Well, yes, a follow-up to that. What was it that what was it then? What was the impetus then that made you put out the advisory? given that the results were inconclusive?
Well, that's just it. The results were inconclusive. It didn't tell us whether there was presence of a contaminant or there wasn't. And so in an effort to be cautious and protective of human health, we put out this advisory.
And then just back to the question I'd asked, what is the plan going forward if indeed it's determined that the water supply is contaminated with fuel or some other contaminant? I know you said that the Board of Water Supply could maybe supply something else, but I mean, is there a plan in place in terms of what to do in terms of remediation, or what are the next steps from there?
Well, if there's, we would always try to remediate the contaminant from the environment, whether it's soil or water. It's always we always look to remediation and protection of human health in the environment. I think in this case, we would do anything we need to do to protect human health in the environment.
Related to that worst case scenario, if there was contamination in the part of the aquifer that services, the majority of the population of this island, would the state and Board of Water Supply find out about that right away, or would it hit people's faucets before they can act to stop it?
I would hope that with this investigation and with the results from the more sensitive results from the samples, we would be able to detect any contaminants in the water.
But in this case, potentially fuel or something, whatever is causing the smell, has reached people's faucets before, in this case, the Navy was able to stop it. Is the Board of Water Supply and the Health Department equipped to catch something before it hits people's homes in the non-military areas?
I think that's a question you need to ask the Board of Water Supply, as they are the purveyors of the water to the general population.
Well, to Christina's question, could you clarify, exactly why it took about 24 hours to get test results back? Because I think that sort of speaks to the concerns about not knowing until it's too late, till people have already consumed water. I mean, is there any way to expedite those test results once you do start getting complaints or smells of fuel? I mean, why does it take so long to get the results back, particularly in light of the fact that we've now been really worried about fuel contamination in our water for at least 7 years now?
The sampling results, the testing would require analysis, which I'm not an expert in that. So I can tell you that it takes 48 hours to do the more sensitive testing and 24 hours to do the less sensitive testing.
And how often is the water tested?
That's a question that the Board of Water Supply can answer. Or I'm sorry, or the Navy. I'm sorry, or the Navy.
I just want to call for a last question and we have to wrap up. Okay, hearing none, thank you so much for joining us and have a great day.
Thank you, everyone.